Assalamualaikum, it's me Farouk Faryajabin. My roll number is B21650063 and my drug is benzyl benzoate. So here is the introduction of benzyl benzoate. Benzyl benzoate is used to treat lice and scabies infestations. This medicine is believed to be absorbed by the lice and mites and to destroy them by acting on their nervous system. This medicine is available without a prescription. This drug can be used tropically but ingestion may cause problems. तो benzyl benzoate basically हम treat करने के लिए use करते हैं, that is scabies and lice infestations. इसके अलावा जो है हम इस ड्रग को जो है टॉपिकली यूज़ किया जा सकता है और अगर हम इसको इंजेस्ट कर लेंगे तो हमें काफ़ी प्रॉब्लम्स क्रिएट होती हैं. Here are some rational uses of benzyl benzoate, that is scabies, pediculosis, veterinary medicines. And these are the irrational use of benzyl benzoate, that is blister forming, crusting, itching, scaling of skin, jerky movement. Here is the toxicity, that is rhabdomyolysis, hypermetabolic acidosis, blister formation, CNS excitation, seizures and death. अगर हम इसको orally ingest कर लेते हैं इस drug को तो हमारे पास ultimately death भी अगर हो सकती है. These are the interaction that is using alcohol or tobacco with certain medicines may cause interaction to occur. अगर कोई पेशेंट अल्कोहल या टोबैको का एडिक्टेड है तो हम उनमें बेंजाइल बेंजोएट को रिकमेंड नहीं करेंगे. These are the alternative drug choices. बेंजाइल बेंजोएट की जगह हम परमेथ्रिन, that is 5% cream फॉर्म में होती है, and मेलाथियोन, that is 0.5% lotion are alternative of benzyl benzoate because they have nearly the same potency. बेंजाइल बेंजोएट की जगह हम परमेथ्रिन एंड मेलाथियोन भी यूज कर सकते हैं. These are the brands and their dosage form. Brands and available dosage form. Escabiol, that is emulsion, can be applied on topically, and these are the price. That is Gamanom emulsion, and this is Hexap emulsion. So here is a case study, that is a 38-year-old Thai woman was admitted to Siriraj Hospital in a semi-conscious state for 12 hours on March 12, 2001. The patient has been diagnosed with schizophrenia and been on monthly perfenazine intramuscular 4 ml, haloperidol 5 mg per day, benhexol 4 mg per day, and diazepam 4 mg per day. These are the drugs जिससे हम अपने पेशेंट को ट्रीट कर रहे थे. 20 hours for admission, she ingested 360 ml of 25% benzyl benzoate which was prescribed for killing lice. हमने इनको रेकमेंड की है 25% ऑफ बेंजाइल बेंजोएट जो कि इन्होंने इंजेस्ट कर ली है, इन्होंने ओरली ले ली है, एंड 360 ml इसका वॉल्यूम था. 12 hours before admission, she became confused and had hallucinations. On admission, the patient height was 165 centimeter and her weight was 65 kg. Her body temperature was 37 degrees centigrade. Blood pressure 110 per 70 mmHg. Pulse rate 120 per minute and respiratory rate 40 minute. She was unconscious but responded to painful stimuli with normal muscle tone, no neck stiffness, pupil size and pendile were normal. Liver and spleen were not palpable and no abnormal sounds were heard in both lungs. Hematologically, these are some lab tests of the patient, and these are the electrolyte values of the patients, that is lab test, and urine myoglobin was not found. Chest x-ray was normal and ECG showed sinus tachycardia with no QRS, whitening or prolonged QT interval. Blood for toxic substance screening, salicylate, that is very toxic for body, salicylate 15 mg per liter. Substance confirmed laboratory, no ethanol, no salicylate in benzyl benzoate preparation. The patient was admitted to the ICU and placed on a ventilator. Intravenous fluid and sodium bicarbonate were used to control severe metabolic acidosis. Initially, हम इनको treat कर रहे थे by using intravenous fluid and sodium bicarbonate. Here is hemodialysis was discussed for supportive treatment of rhabdomyolysis. Rhabdomyolysis के लिए हमने hemodialysis use किए हैं and acute renal failure and hypermetabolic state in this patient. After a week of hemodialysis, the patient was extubated and moved to the ordinary ward. In second week, she developed fever and sputum culture revealed Acidobacter bacteria, which was resistant to all antibiotics. She died during the third week of admission. No autopsy was performed. Here is the subjective schizophrenia, metabolic acidosis, rhabdomyolysis, hallucination, unconscious, responded to stimuli, no neck stiffness. And these are the drugs जिससे हम initially patient को treat कर रहे थे. These are the objective, these all are the lab tests, that is blood pressure, pulse rate, respiratory rate, hematocrit, hemoglobin. These are the lab tests of the patient. These are the electrolytes. Okay, so assessment. Increased benzoic acid causes metabolic acidosis and rhabdomyolysis. बेंजाइल बेंजोएट को इंजेस्ट करने की वजह से बेंजोइक एसिड की जो है क्वांटिटी के बढ़ने की वजह से हमारे पास मेटाबॉलिक एसिडोसिस एंड रेप्टोमायोलाइसिस की वजह बन रही है. और हेयर इज अ प्लान कि हम इसको किस तरह से ट्रीट करेंगे. हमारा क्या प्लान हो सकता है. प्लान हमारा ये होगा कि एलिमिनेशन ऑफ बेंजाइल बेंजोएट बाय हीमोडायलिसिस. हम पेशेंट को हीमोडायलिसिस में रखेंगे और दूसरा काम हम ये करेंगे कि आईवी फ्लूइड एंड सोडियम बाइकार्बोनेट को यूज करेंगे. इसके बाद भी हमारे पेशेंट जो है वो फर्स्ट वीक तक बिल्कुल सही रहता है, लेकिन सेकंड और थर्ड वीक में उसकी तबीयत जो है वो कंडीशन बहुत ख़राब हो जाती है और थर्ड वीक में अल्टीमेटली बेंजाइल बेंजोएट की वजह से जो है उसकी पेशेंट की डेथ अगर हो जाती है जस्ट बिकॉज ऑफ दिस एसिडोबैक्टर बैक्टीरिया जो कि उसमें उसके स्प्यूटम कल्चर में पाया जाता है. So here are the references, and that's all about my presentation. Thank you.